Hello and good morning. Welcome to another Wellness Wednesday. This Wednesday, I want to talk a little bit more about the difference between ice and heat and when you should use either of those. That's a very common question that I get here in my office. So I always like to say, anytime we've done activities out of the normal where we are overdoing it or getting inflammation or injuring ourselves, we always want to use ice first. Ice helps to numb the nerve fibers, so we reduce pain. It also helps to reduce swelling in the muscles and the tissue surrounding the joints as well. Typically, along with ice, I usually recommend rest for the rest of the day. So after overuse or activity, you want to ice for about 15 minutes or so, and then you want to rest for the rest of the hour. You can ice up to once an hour for 15 minutes, so you want to make sure your tissue gets back to normal temperature because nobody likes frostbite. So ice for 15 and then take a break, and then you can repeat that again the next hour. Now, if we have, say, a more chronic injury, or if we have a bad knee or an injury that we've had multiple times, and we are noticing that it is sore or aching or stiff, typically I would recommend heat in that situation because we want to bring blood flow into the area so your body can start to heal the joint and we can get some relaxation of the ligaments and the muscle to soothe and let the body get in there and heal it. Now, there are some situations where somebody's kind of in the midst of a healing process where they maybe are doing new exercises or doing activities and using different muscles that potentially they have overdone it a bit. And I usually recommend ice that day and rest and stretching the rest of that day. The next day, if they're feeling stiffness, they may want to do heat and then stretch again. So best rule of thumb, if you have inflammation, you can never go wrong with just ice. There's no problem with that. However, if you do heat and you're bringing blood flow in, sometimes you can actually cause swelling if you're doing heat on an area that should do ice. So if in doubt, you can do ice first for 15 and then heat right afterwards for 15 and then rest the rest of the hour. Hopefully this is helpful for you. Next week, we're going to talk a little bit more about products you can apply to your skin to help with joint pain and muscle pain, things like Icy Hot or Arnica or MSM creams. And we're going to talk a little bit more about what those are for and what might be beneficial for you. So again, hopefully you learned some things this week. Again, ice for new injuries or irritation, and then heat when we have an old injury or stiffness going on to help bring in blood flow. And when in doubt, ice for 15, heat for 15, and then rest the rest of the hour. Have a great rest of your week, and we'll see you next week on Wellness Wednesday.